Well, as the Delta variant sweeps through Georgia, children's hospitals have seen a rise in kids being hospitalized. At Children's Healthcare of Atlanta, nearly 24 children are hospitalized with COVID-19 right now. And in hard-hit Southeast Georgia, pediatric ERs are packed. The Fox Medical Team's Beth Galvin has more on how the virus has affected kids.
The number of children hospitalized with COVID-19 across Georgia is rising, and along the coast in Savannah, they're seeing kids hospitalized from 18 all the way down to newborn babies in the neonatal intensive care unit. 2 newborns were among 7 children hospitalized with COVID-19 at Memorial Health Willett Children's Hospital in Savannah Monday.
The number of women that are showing up laboring and COVID-19 positive has increased significantly, at least in our region, and I believe it's held true in most health systems.
Dr. Stephen Thacker, Memorial Health's Associate Chief Medical Officer and a pediatric infectious disease specialist, says they've had several newborns born prematurely, likely infected by their moms.
So we have some neonates that are infected and being cared for because of their prematurity, and we've just made the matter more challenging because now they have infection that they got at time of birth. And thankfully, those children in the grand scheme are stable and doing well. But for a baby being born prematurely, we don't need to add any other challenges to their health and keeping them well. And COVID-19 certainly does that.
Across the state, pediatric hospitals are busy, not just with COVID-19, but RSV and other medical emergencies that bring children in during the summertime. Children's Healthcare of Atlanta has 22 kids hospitalized with COVID-19, up from 4 a month ago. Most have underlying health problems that put them at higher risk of complications. And then there are the children's emergency departments and urgent cares.
Nearly every pediatric ER in the region, including our own, is very busy with a large number of individuals wanting their children tested for mild symptoms or prior exposure. Part of the messaging is that we need to reserve our emergency rooms, whether it be pediatric or adult, really for those true emergencies.
If your child needs to get tested for COVID-19, Dr. Thacker recommends calling your pediatrician or primary care doctor or going to a testing site outside of a hospital. And he's reassuring parents that
most kids who do get symptomatic infection from COVID-19 are going to be okay. It is rare that they end up having need for hospitalization.
And Dr. Thacker says your best bet is to try to avoid kids getting infected with the Delta variant. You can do that with kids who are 12 and older, he says, by getting them vaccinated as soon as possible. If your child is too young to be vaccinated, he says make sure that they're wearing a mask at school and in public, and try to make sure that every adult who is around your child is fully vaccinated. For your Fox Medical Team, I'm Beth Galvin.